The Crohn's and Colitis Foundation of America is a non-profit organization dedicated to finding cures for Crohn's disease and ulcerative colitis. CCFA works to improve the quality of life of children and adults affected by these digestive diseases. Crohn's disease is a chronic inflammatory bowel disease that affects the lining of the digestive tract. Crohn's disease can cause abdominal pain, diarrhea, weight loss, anemia, and fatigue. Some people may be symptom-free most of their lives, while others can have severe chronic symptoms that never go away. At this time, Crohn's disease cannot be cured. Medications such as steroids and immunosuppressants are used to slow the progression of the disease. In some cases, medications simply just do not work, which means the patient may require surgery. CCFA is also devoted to finding a cure for a disease called ulcerative colitis. Ulcerative colitis is usually only found in the colon or rectum. Symptoms include rectal bleeding, bloody diarrhea, abdominal cramps, and pain. Treatment includes medications and surgery. According to the Crohn's and Colitis Foundation of America, about 1.4 million Americans have Crohn's disease or ulcerative colitis. Of those, about 700,000 have Crohn's. In the years between 1992 and 2004, there was a 74% increase in doctors' visits due to Crohn's disease. In 2004, Crohn's disease was the cause of 57,000 hospitalizations. I was diagnosed with ulcerative colitis when I was 12 years old. For 1 year, I was living with symptoms that my family and I thought were just regular stomach aches. We tried many over-the-counter medicines and nothing helped. My doctor finally referred me to a gastroenterologist, also known as a GI specialist. The doctors tried many different types of medications that were known to help with ulcerative colitis, but nothing worked. When I was 14, I had a surgical procedure done and my doctor re-diagnosed me with a different disease called Crohn's. Just recently, we have found a new medication that is working to control the symptoms. I probably will never be cured, but for now, I feel better. These two diseases are very similar. Most doctors have trouble trying to diagnose a patient. Often patients get misdiagnosed with one or the other and must undergo many tests to find a definitive answer. Crohn's is an expensive disease. In a 2008 study, direct medical costs were $18,022 to $18,932 per patient per year in the United States. About 53 to 67% of those costs were from hospitalizations. Costs were higher for patients with more severe disease symptoms.
It is important that we find a cure for Crohn's, ulcerative colitis, and every disease that people must battle with every day. I want everyone to be aware that people struggling with illnesses will not always appear to be in pain. That does not mean that is the case. Be supportive and kind to the people around you. I'm sure we would all appreciate it.